Welcome, everybody. We're going to go ahead and get started. Other people maybe will join in as they can, but we'll go ahead and get started so we can keep the presentation on time. We got a lot to cover today. Like you can see from the slide, our topic today here in March is healthy coping, mental health and diabetes. Diabetes doesn't only affect your physical health, but I do believe we spend a lot of time talking more about your physical health and how diabetes affects that. Last month in February, February is Heart Health Month, so we spent a lot of time talking about how diabetes affects your heart and all of your vessels in your body. We had a guest host that day, Jana Smith, who's an RN and had a lot of experience in cardiology. But diabetes doesn't only affect your physical health. It can affect your mental health. And I think mental health issues are not discussed enough. I think we in the medical field get caught up more on what medication you're taking, what other medication we can start you on, monitoring your blood sugar, getting you a glucometer, even getting you a continuous glucose monitor. And I'm guilty of this. Near the end of all the education that I do with a patient, I get to the point where I'm like, this isn't all working. What's going on? We've tried everything. Well, then I start realizing, we didn't actually check with their mental health. We didn't assess that. And maybe there's something that's going on that's kind of blocking a person from actually, being self-managing and being successful in that. So I really, truly think, our theme for this year, for 2022 is let's get serious on this. And so I really think if we're going to get serious on managing diabetes, we got to start looking at the mental health and along with the physical. Okay, so you will see attached, Haley's attached, like I said, these scales, they're called, or they're questionnaires. I got 6 of them. I'm sure there's more than this out there in the real world, but these are the ones that I found with the American Diabetes Association. The first one is, what's your score on the stress test? And we're going to look a little closer at that. There's the problem areas in diabetes, or the PAID scale, diabetes distress scale. The diabetes distress scale is a 17-question scale. So none of these are overwhelmingly, there's not a lot on any of them that it would take you long to look through them and answer them. There's a specific scale just for someone who has type 1 diabetes, for hypoglycemia, which is low blood sugar. And a lot of people fear low blood sugar. A lot of times that's why someone doesn't want to take their diabetic medication. So if that seems like something that might be affecting you, then I ask you to look through those questions and answer them truthfully. And then also an insulin treatment appraisal scale. Again, I don't know how many times I've met with patients who just don't want to even start insulin, whether they think it means that they are, they've been bad, they call themselves bad, that they aren't managing their blood sugar correctly. That is not true. If someone has to start on insulin, it just means your body is not working right with you right now to produce insulin. So we all need insulin for survival. And we're thankful that we can actually get it without our pancreas maybe being the one releasing it. So if you are afraid of starting insulin, or if you're having trouble as you take insulin, being concerned with it, those questions would pertain to you. So again, I think that if we're going to get serious on self-managing diabetes, it's time to do self-assessments. And these are some scales or questionnaires that can help you start self-assessing. And then we're going to talk about what to do once you do that. If you find that there's an area that's of concern, what should you do with that information? So, I, as a nurse and as a diabetic educator, have experience with that. But when it comes to overall knowledge or experience with the mental health side, I believe I lack in that. So I definitely needed a co-host today, someone who has a lot of experience with helping people on the mental health side that also ends up helping their physical health when they get it all working together. So I have my co-host today, Zac Milam. He works in our behavioral health department. I'm going to let him explain his credentials and his experience a little bit, because I'm not sure that I had that I have all of the letters that are probably after his name listed here. So Zac, if you just take a few minutes, introduce yourself, tell us about your experience, and what is your role here at Valley Professionals?
Sure. So I am a licensed mental health counselor. I have been working with Valley for almost 5 years now. I've been a therapist for over 10. I started off working with children and adolescents, and then started working in home-based services for a little while before coming here to integrated care. As a therapist, I'm work as a lead in Park County over the other therapists, as well as the Cayuga site.
Okay, all right. So along the way, if you, along the way, if you have questions for me or for Zac, again, I'm trying to encourage participation. You know, I know last year we tried to do just presentation. We didn't have a lot of participation. We had to work that out. You can raise your hand on your screen of your choices. There'll be a hand that'll say raise your hand, or you can send us a message through chat. And if you'll do that, then Haley will kind of monitor that and let us know if there's questions and things that we need to look at and address. I have the first question. I guess I'm going to be selfish. I'm going to start it and ask Zac this. So diabetes versus other chronic conditions. I'm kind of interested in is if Zac's noticed any difference in how people with diabetes have more concern with this chronic disease of diabetes than when compared to other people who have other chronic conditions but don't have diabetes. So what do you think, Zac? Have you noticed a difference in people who have diabetes? Do they seem more overly concerned with the overall management of diabetes and care?
Sure. So something that I noticed right off the bat about chronic illnesses is that those individuals, maybe heart disease or COPD, not to say that they aren't a concern to them, but they don't actually seem to exist in the forefront of their minds. So individuals with diabetes, they seem to have more struggles with that because of increased self-awareness and the daily self-management that they have to do just in checking their A1C constantly and everything that they consume impacting mood, energy levels. And so they have far more readiness and awareness of the stressors that are present in comparison to other more chronic issues.
Okay, yeah. Thanks for bringing that up. Yes, that's true. That's something we've talked about in the past in other groups, is that it is that daily, constant having to do something to self-manage blood sugar. Yeah, so this next slide is just a group of descriptive words that a lot of my patients have used when I've met with them. So, you know, looking over these words, these descriptive words, they call it challenging, even a social stigma. So especially I have young kids or teenagers, you know, type 1 diabetes, where they don't want to stop what they're doing. They don't want to and give their medication. They don't want to, you know, it limits them maybe in sports, or they think that it could limit them. They don't want to be different than the other kids around them. There's an emotional response. They describe diabetes as a burden. It's relentless. They're overwhelmed. Are any of these words anything, you know, do you find these words that your patients that you've met with, do they ever use these words, I guess?
Yeah, some of them that really stood out for me, especially when I was looking over this slide, was obviously stress, lack of understanding, emotional response, the financial cost, which is a stressor in and of itself, but feeling defeated, which, you know, leads to individuals feeling kind of helpless and hopeless at times.
Yeah. Yep. All right. Well, so we're going to take stress to start with, because you're right, is one, to me, when I looked at this, I kind of thought some of these descriptive words on here actually could add to stress. So like I didn't know if stress was kind of the thing that everything was built around or not. But, you know, we talked about, again, those scales that Haley has got uploaded for you guys. And the first one is focusing on stress. We're going to talk about that specific scale here in a little bit. But just for a definition of what is stress, you know, you can read the slide: or reaction to perceived danger, conditions that seem uncontrollable, situations that require emotional behavioral change. And when we sense a threat, we either run or fight, and whether the threat is real or imagined. But I want Zac to just give his own personal kind of description of what he would say for stress, instead of, this is more of a textbook description. So Zac, what do those are some big words. How would you describe stress?
I think it's a good definition. The one thing when I think about stress is that it has to do with uncertainty, not knowing what the future is going to hold, and the fear that we feel because of that, because we don't know if we're going to be able to control the outcome. We don't know what this looks like. And while stress and our anxious reactions are initially meant to protect us, the way that our world is now, there's a stress overload. And so we misinterpret certain things as being stressful and life-threatening when they actually aren't. But I would say that predominantly in my head, it has to do with uncertainty to outcomes.
Okay. And then we were talking earlier, I just wrote on there, we either are going to run or fight, but you said there's even a third thing that we could possibly do. What was it? Describe that.
Sure. So you have the fight or flight response. Essentially, it has to do with survival. And if the lion is going to chase us, do we fight the lion or do we run up the tree? So that's fight or flight. Now, the other factor is actually fight, flight, or freeze, which means that we are often frozen into inaction. Our brain freezes and we don't fight or we don't run away. We just kind of sit.
Okay. Yeah. Yeah. And like I was talking to Zac earlier, it's like that was, as he said it, I go, yeah, that makes sense, but it wasn't something that I'd actually thought of. So I'm glad that he added that as an option. And maybe that's something that you've seen in yourself, is what I'm hoping, that you're kind of doing that self-evaluation. So how do we know that we're stressed? And I think I'm even thinking of myself in this, because I've been, whether I'm not getting good sleep or I'm just not eating as healthy as I used to. And I'm thinking, what's going on? And as I start looking back, I can actually see some stress that's been in my life. And I didn't realize it was that was causing these things till I was doing this presentation. So I kind of learned a lot on my own. But Zac, does everyone experience stress the same? And what are some of the signs and symptoms someone might actually have when they're stressed?
So I would say 100% no one is going to experience stress the same. They might have some overlapping symptoms or some things that you can have in common with individuals with anxiety or stress, but everybody's going to experience it differently, and they're going to interpret their symptoms differently as well. Some of those symptoms involve like muscle tension, restlessness, fatigue, lack of energy, feeling tired, change in your sleeping habits. Now, that can be either you're unable to fall asleep, or maybe you fall asleep but you're waking up multiple times throughout the night and you're having a hard time going back to sleep, or in an effort to avoid the anxious feelings, you're oversleeping. You're going to notice sometimes rapid or shallow breathing. Your heart is going to beat irregularly, or you're going to notice a rapid heartbeat. You might feel like your legs are going to give out from under you. Muscle tension is actually a big thing, and people might be tense. They might bring their fingers and their hands more. And I'll often ask patients whether or not they experience a lot of tension headaches. Tension headaches are a big culprit when it comes to stress and anxiety.
Okay. All right. So again, the attached documents. The first one that was on that list was, what's your score on the stress test? So this specific questionnaire is based on the last year. As you read through the list, you're going to think of what's happened to you in the last year. And if the events apply to you, you write that point or score that this questionnaire gives that event. So I just listed some of the events I thought were kind of interesting because they popped out, especially in the last 2 years with COVID. But a lot of people have talked about changes in sleep habits, changes in the number of family get-togethers. Vacation, I thought, was an interesting one. It's supposed to be something that relaxes us and we all look forward to, but there are times when it causes more stress than it's worth. Christmas, again, a time of family and get-togethers. It should be relaxing and fun, but it can cause stress. Change in church activities, change in recreation, change in eating habits. Some of those things, again, were changed on all of us without even us getting to choose that, in the last 2 years. But there are 41 different events listed with different scores. So for example, if you have a change in sleeping habits, you would get a score of 16 points, but a change in work responsibilities would be 29 points. So they're weighted. And those life events, because of the amount of stress they can cause, can actually, that's why they're weighted, because you got to give them that number. So if you're going to do this, if you're going to get serious on this, if you're going to actually try to do some self-assessment, you got to put the score that's actually next to that life event. If you have a change in sleep habit, you have to put a 16. You can't put an 8, like, oh, well, sometimes, no, it's the whole 16. And then again, this is what's happened in the last year. Have you experienced this? Each one of these scales or questionnaires has a different time frame, and this is the last year. And you might be thinking, well, gosh, yeah, I remember 9 months ago having trouble sleeping, but I'm okay now. But still, it'd probably be best to go ahead and put that down as your overall score. Then you can always go back and, again, check off, am I doing okay with that? But so when you do go through what's your score on the stress test, if your total score is under 150, well, then you're not doing too bad. If it's 150 to 199, there's a mild increased risk of health problems associated with stress. If your score 200 to 299, there's a moderate increase, and 300 or over, there's a high increase of, again, the stress of affecting your health. I'm just going to ask Zac this. I hadn't prepared him for this, but Zac, when would you suggest someone reach out to their doctor or to a counselor? I mean, would we reach out even at 150 if there was something that, that was a positive and we thought it was a problem in our life?
I would say that, and I think that I was going to talk about this maybe later, so I might touch on it again. I apologize if I repeat myself, but I think that if we feel as though what we're experiencing is getting in the way of our everyday functioning at the level of what we have been, like maybe I'm not spending as much time with friends, or I'm a little more irritable, or I'm noticing that I haven't been eating as much. If you feel as though some of these things are getting in the way of everyday life, then I don't think it's out of the question to talk to a provider. And the worst thing that can happen is you guys have a conversation about it, and you either get the help that you need, or you're feeling better because what you're experiencing is more normal.
Okay. Yeah. Thank you. I think that's what I was thinking, but I didn't know for sure. I always think if there's anything that's concerning for you, you should always just call us, and talk. And so I was going to point out, a lot of times when you see your doctor or your nurse practitioner here at Valley Professionals, you might see them every 3 months or every 6 months or every year for your chronic conditions. You might have an acute where, oh, I got a cold or I've got the flu. So you get an appointment with them just for that quick acute appointment visit. You can get those symptoms taken care of. But please do not think that you can't call us in between times. That's what Valley Professionals here for. That's why they have offices in all the small towns around the area. And whether maybe if you can't get in to see with your provider, we have other providers who'd be willing to see you. But your provider always wants to know what's going on with you, especially if you perceive there's a problem. Call. It doesn't hurt to get an appointment. Come in for an office visit, and get it checked out and have, like Zac said, have a discussion. So, if we determined after you looked at, you did the assessment to see what's causing stress in your life, what do we do when we're feeling stressed? It's inevitable. I think everyone's going to have stress at some point. It can be simple. You're having the best day, and then someone pulls out in front of you, when you're on the road. So, that can cause some stress, and life, happens. And so there's going to be stress. So my question is, Zac, what are some recommendations you have for people with diabetes when they do have stress, and to kind of help relieve some of that stress?
So there's a number of different things that we can do for coping and self-care. Top of the list, which may sound predictable for me, if I were to talk to anybody about healthy coping and self-care, it would be eating and exercise. And I realize that kind of feels like a given, but I'm not talking about running a mile on a treadmill. Exercise could be something as simple as walking down the road and just getting outside for a little while, getting active. What you put in your body is also going to contribute greatly to the stress that you experience. And while different kinds of foods can impact you neurochemically, that's probably for another time. What I will say is, when it comes to this, if you're already stressed about being diabetic and your diabetes managing your illness, you're going to be cognizant of what you put in your body. And so if you eat something that maybe you shouldn't have, not only are you going to feel worse physically, but emotionally, you might experience feelings of guilt, shame, fear. You might hide it from other people out of that guilt or feeling embarrassed. And so that's going to worsen your stress that much more. Journaling is also helpful. I would say seeking out your supports, family, friends, other individuals that you're close with that have diabetes. Jill and I actually spoke with each other prior to this, and she brought up a good point about how some of these individuals might be a little overbearing when it comes to this, which I hadn't really considered, but hopefully with the right resources, they would be able to be helpful. And in the same light, I would also encourage you to allow other people to help you, allow for that support. You don't have to do this by yourself. The more lonely and isolated you feel, the more your anxiety is going to escalate. We have to be able to ask for help and lean on others, whether it be providers, therapists, family, friends, other individuals going through what you're going through. Ask for help and allow them to help you. If you don't understand something, ask questions. There's no shame in that. Nobody expects you to know everything. Ask questions if you don't know, you don't understand. If you're a person of faith, praying, seeking church family is really helpful. Planning is really helpful as well when it comes to stress. I touched on earlier about how anxiety is often caused by the uncertain future. We can't control everything, but we can plan for certain things that we can control. And the more of a plan that we have, the more we're able to decrease some of that anxiety because we can have some say in what we experience. Touching on the slide before, some people may not consider like Christmas, family vacations, promotions, weddings, birthdays. They may not consider those stressful. They might consider those good things. But the reality of it is that we're creatures of habit and routine, and anything that interrupts anything that interrupts that routine or a transitional period will cause a certain amount of discomfort or anxiety just because it's new. And so it's important to look to the future and plan for anything that may trigger stress reactions or anxiety.
All right, great information. Thank you. So yes, we did kind of myself. So we did kind of talk about this briefly. When should a person seek help? But main thing too is I was wanting to know, like, if somebody's interested in coming to a counselor here at Valley, what's the steps to get them to actually be able to see a counselor like you are? And because we have multiple ones that at every building we have counselors, sometimes more than one. And so I'm not sure of the process. So Zach, could you let us know what that process is?
Sure, absolutely. Like I said before, anxiety is actually meant to be a good thing. It's adaptable. It's supposed to help us perform our best. A certain amount of anxiety is healthy, but when it gets to a point where it causes dysfunction and disrupts our everyday life, that's when we need to be thinking about getting help. And so in order to see one of the therapists at one of our locations, you obviously have to be a patient here, and you would speak with your primary care provider, and you would express interest in seeing somebody in behavioral health, talking to a therapist. Now, at every location, our PCPs have the ability to come and get one of us. So I'm here in Bloomingdale, and if, say, Nicole, who is a physician's assistant, is down the hall, if she has somebody in the room who's expressed an interest or she thinks she wants to refer them to behavioral health, she'll come and grab me, and I will go and talk to them right away. And we'll set up a relationship right there, and we'll get things planned to get you scheduled. Now, if I'm not available, that doesn't mean that you don't get scheduled. It just means that she will put in a referral and you'll come and see us for an initial assessment. But you have to go through the PCPs in order to see us. And say you're in here for an appointment and you express some of that confusion about your diagnosis or anxiety or depression that you're experiencing because of your diagnosis and what you're experiencing with trying to manage your illness, you can say, I'm interested in talking to a therapist, and she'll come and grab one of us.
Okay. All right. So the main thing is that if you're finding that you're having more stress, anxieties, whatever's going on, definitely get an appointment with your provider. Even when you call, if you let the ladies know who answer the phone, hey, this is why I'm calling, this is why I want an appointment, they may kind of expedite that, appointment with behavioral health if they, as they can. So we have a lot of resources here at Valley Professionals. Besides, we've talked about the care coordinators that we have who can help with education and helping you manage any chronic condition you have. You have me, the diabetic educator, and we have behavioral health. Of course, we have your providers, your nurse practitioners, your doctors. That's what Valley Professional does. They're more of that, your patient-centered medical home where hopefully we can have more things under one roof so that you can come here when you need help. All right, so excessive stress works against diabetes management by, just stress alone can cause your blood sugar levels to go up. Some people they do great with managing blood sugar. They think they're doing everything right. And then they have high blood sugar and they don't know why. So then we start talking about stress or all the things that can affect blood sugar. It's not just food or lack of exercise. Excessive stress can incite strong negative emotions, impair sound thinking and decision-making, and tempt compulsive and poor eating. And this is what I see sometimes when I have patients who are under stress. They start thinking negatively. I can't do anything right, or they don't think soundly, like they stop taking their medication altogether. That's not a good idea. If you're interested in stepping off your medicine, stepping back, or stopping it, you got to have an appointment with your doctor so we can make a plan. Like Zac said, it's always good to have a plan. The prolonged stress is hard on your body. It makes your heart work faster and harder. There's a negative impact on your immune system, your digestive system, your kidneys, your ability to think clearly. The mental strain can, even if not taken care of, can actually lead to depression. So we're just encouraging you that, if you already know that you're experiencing stress and it's affecting your health or your ability to self-manage diabetes, specifically, that's what we're talking about today, then whether you've taken that questionnaire that I talked about earlier, how the stress questionnaire or not, definitely give us a call. And let's see what we can do to help and work together to help you and to support you. So I don't know for sure, but the way I was looking at this was, to me, there's stress, there's anxiety that we all kind of experience at different times. But if it goes a little further, a big topic that's being discussed in the diabetic world lately, and I don't know that it's really not new, it's just that it's coming to the forefront, is diabetes distress. And I've actually seen this in some of my patients. But this is an area of diabetes self-management that I believe I'm guilty of not talking enough about with our patients that I meet with. We spend so much time, like I said earlier, on medication and exercise and diet, that I think this gets pushed to the back. And I really think it needs one of the first things we address, maybe some kind of a general questionnaire, like one of those questionnaires, like the diabetes distress scale, that again is an option there for you to download, and have everybody kind of evaluate themselves so that we're more aware of what part of diabetes is causing you distress. It may be medication, it may not be. It may be not wanting to take the medication, or maybe the cost of the medication. I mean, there's so many avenues with that. So let's talk more about, specifically, we're going to focus in on diabetes distress. And I have one of those questionnaires or scales we're going to actually look at real close. But just to define diabetes distress, it's the emotional response to living with diabetes, the burden of relentless daily self-management, and the prospect of its long-term complication. So again, as our theme this year is, let's get serious on this, I'm going to get real with you. I'm not sure if anybody's ever told you this before or not. And I'm not saying all this to cause you more stress, but diabetes is a chronic progressive disease. So, chronic means it is a disease that isn't going to go away. It's got a long-term definition to it, effect to it. And then progressive means that it will continually require more treatment and changes in treatment. And I think that's some things what can be overwhelming if you start looking too far into the future. But I use the word diabetes because that is, once you're diagnosed with diabetes, it is a disease that you have, and we don't take that diagnosis away, because if you were to stop, whether it's stop taking the medication, stop eating healthy, stop exercising, whatever, that could actually, even though you might have blood sugar well controlled, that could cause blood sugar to become uncontrolled. So the important thing is well-controlled blood sugar. So whether you have diabetes or not, well-controlled blood sugar is the main thing we got to work on. We got to focus on it. We got to get serious about that. It's true for everybody. Everyone in the world needs well-controlled blood sugar. Some of you are more aware of what your blood sugar is because you have diabetes and you're monitoring it. Some people are unaware what their blood sugar is, and they're not paying attention to it, and their blood sugar is still high. So diabetes distress, it can be an emotional response because this is a chronic progressive disease. And even though you've done everything right, sometimes it can be overwhelming. So diabetes distress is when a person with diabetes feels frustrated, defeated, overwhelmed. Those feelings can come and go. I mean, I've met with patients before where they're doing fine, and the next thing you know, they have this huge distress going on, and they're just done with diabetes, done. But then they get back on and do well again, and then again, whether it's other things in life that gets them to this point, or just diabetes management in general, they get again into that area of they're just under distress. It doesn't, and this was something interesting to me, I wanted Zac to kind of maybe touch on. Diabetes distress doesn't mean that you have these feelings about other parts of your life. It almost sounds like this can focus just on diabetes while other things are going okay. I mean, Zac, can you help explain that, or do you agree with that concept? Sure.
Yeah, I would say too that diabetes distress is something that is newer to me in terms of I suppose that I hypothesize it more of like burnout. But I would say that there is definitely a level of anxiety and distress that can be exclusive to diabetes in the same way that people might have social anxiety, or they might have anxiety related to driving. It doesn't mean that all areas of their life give them distress. It just means that there are certain aspects of their life that triggers their anxiety. And I would say that the level of care you have to give to yourself with diabetes can definitely contribute to its own anxieties. And so I would say that even though it can be exclusive to your illness, it can trickle in and impact other areas of your life. So while your anxiety, the core of your anxiety might focus on managing your illness, you might find that you're more irritable. And so maybe you're going through Walmart and you have a negative interaction with the cashier, or maybe you go home and the dog's more annoying than usual. It doesn't mean that the other areas of your life aren't immune to being impacted by your distress you're experiencing with your burnout with diabetes. So I would say that while there is like an anxiety that's exclusive to managing your illness, there's also, we have to be careful not to let it trickle into the other areas of your life, which we talked about everyday functioning and talking to a provider about getting some help. This would be one of those times when it extends any anxiety that you experience with your illness and starts to impact everyday living in other areas of life.
Okay, yeah. All right, all good points. Let's see this next slide. So diabetes distress can also arise from the social impact of diabetes. I think a lot of times people don't think about it. They think that, it all has to do with their own self-management, but sometimes other people's unhelpful reactions or lack of understanding can actually add to your distress. Whether it's a loved one telling you can't have something to eat or you shouldn't be eating certain foods. That happens a lot as I meet with patients. I hear that a lot, whether it's a husband, wife, or just, going to family dinners are very stressful for them because everybody's watching what they're eating and questioning them. And I tell everybody that the American Diabetic Association, and that is the association that endocrinologists quote because they're the ones that are doing the research. They're one of those associations that endocrinologists, people who manage diabetes, who are specialists, quote. The ADA does not tell you can't have something specifically to eat. They do ask, can you eat less of it? Can you look at serving size? Could you find something that's more healthy? But they don't tell you can't have something. So that's something I always tell everybody, so you can use that at that next family event. You can tell them, no, the ADA says, I can have this. So there's also the financial implication that can add to stress to managing diabetes, the cost of medication, whether it's, the cost of insulin or the cost of a new medication your doctor's wanting to start you on, the cost of insurance in general, or the cost of treatment that comes along with diabetes. And I even thought, I didn't even put this in, but I just thought of like all the, the equipment, if you're getting an insulin pump, if you want a continuous glucose monitor, it's all can be very expensive. So there's a financial implication also to the disease that can add to the distress. So I wanted to look at, again, one of these questionnaires that Haley posted. This one's called Problem Areas in Diabetes, or PAID, P-A-I-D, an acronym for this scale. There are 20 questions. You answer the questions with the thought of, is this currently going on in your life? So the previous stress scale or this previous questionnaire was what happened in the last year to you. This one's very current, and I would say even just the last week, and don't go any further back than that. There are 5 different choices when you're answering these questions. The choices are like not a problem, a minor problem, moderate problem, somewhat a serious problem, or serious problem. And that can get kind of confusing, but if you actually look at the questionnaire, they've got it, in columns, so you can just circle the one answer that seems to go with that question. And we're going to look at them here in a little bit. You're going to choose the answer that best describes you for at this point in your life, if this is going on currently or is a current problem for you. So let's look at some of the questions. Oh, first there's a patient, and again, this is not one single patient. This is since I was been a diabetic educator since 2015, and so as I put together some of this, these are some of the things I've seen going on. And when I have used this questionnaire, the problem areas in diabetes, I found a disconnect between what was actually going on, maybe with the patient and their health-wise, with what's going on with their mental side. So let's look at that. So this is just a patient. I put some ideas together of some things that might be going on, that then when we answer the questions, you're going to see what I'm talking about. So their A1C had gone from 8.0 to 9.9 in the last 6 months. So that's a pretty big jump in the last 6 months. At this point, the kidney function's abnormal, their cholesterol levels are high, they're taking insulin at meals and before bed, they're not checking their blood sugar, they've got neuropathy in both their feet, they're sometimes skipping their insulin because if they're out to eat, it's just difficult to take their insulin with them, or they don't want to take it in front of people at a restaurant. And the patient I'm going to call not a problem, has had diabetes for 15 years. So quite a while of having diabetes. The longer you have diabetes, the longer, I guess I should say, you have uncontrolled blood sugar, the more likely you're going to run into some of those risk factors that come along. And again, I'm emphasizing uncontrolled blood sugar. So these are the questions, and I put the answer that I got from the patients as I've given them this problem areas in diabetes questionnaire. So these are some of the questions. Not having a clear, concrete goal for your diabetes care, the answer was not a problem. Feeling discouraged, not a problem. Feeling scared, not a problem. But when you get to number 4, that uncomfortable social situations related to your diabetes care, people telling you what to eat, there's a minor problem. And even though to me it wasn't like, they didn't mark it as a serious problem, at least compared to not a problem for most of the answers, this at least flagged that there might be a problem there. Feelings of deprivation regarding food, feelings depressed when you think about living with diabetes and not knowing if your mood or feelings are related to your diabetes, all not a problem. But we get to number 8, feeling overwhelmed by your diabetes, not a problem. So it's becoming more interesting to me that this patient, again, before A1C's gone up, kidney function's going down, a lot of stuff's going on, but all I'm getting for answers is not a problem. Let's look at the next. So there's 20 questions. I only got 19 on here, but I got the same answers when I worked with these patients, not a problem. But I can't see that top one. Can you see what that says, Zach, that top one that's highlighted?
Coping with complications of diabetes.
Yeah, not a problem. Thank you. I can't see it because my bar's there in front. Feeling angry about living with diabetes, not a problem. Feeling constantly concerned about food and eating, not a problem. Worrying about the future and the possibility of serious complications, not a problem. Not accepting your diabetes, nope, not a problem. Feeling that diabetes is taking up too much of your mental and physical energy, that's number 17, not a problem, which may be true because they're starting to skip medicine. So it's not a problem because they aren't worried about it. Feeling burned out by the constant efforts needed to manage, they say not a problem. I guess, and this is where I wanted Zach, really his expertise to come in. I see a disconnect. I see the patient that we looked at an example where the A1C is up, even in just last 6 months, kidney function down, cholesterol levels up, not taking medication all the time, not checking blood sugar, a long-term diabetic with uncontrolled blood sugar occurring, neuropathy in both feet. So we're already seeing a lot of those chronic conditions. But yet when questions were answered, they just kept saying not a problem. Zac, can you help us understand this disconnect? Because I want, as you guys who are listening a part of this, I want you to answer those questions. If you choose to do one of these questionnaires, answer them as truthful as possible so that we can, your doctor or nurse practitioner, counselor can help you get the help you need for self-management. But Zac, what might be going on with someone who keeps saying nothing's a problem?
When we talk about this, the first thing that I think of, I go back to the fight, flight, or freeze response. And a lot of what I see here is more of the freeze, the sort of inaction, there's no problem. I would say that is probably most influenced by avoidance, acknowledging that there's a problem. There's, the negative stigma that they're trying to avoid, or just the fear of what it means, the meaning behind it. What I would also say is that sometimes it's so overwhelming that it just feels impossible to confront this. And if we avoid it, it goes away. The only problem is when we have stress or anxiety about a certain thing, and the longer we avoid it, the bigger that monster grows, and our anxiety swells, and it goes from being something that you're a little bit stressed about to something that's completely crippling and debilitating, and you can't get past it. And so it takes a small stressful problem and makes it something insurmountable, which is, something that's why you want to ask for help. That's why you want to get information. And the sooner you're engaged in your treatment and your self-care, the better off you're going to be, not just for your physical health, but just your emotional and mental health as well.
All right, great. That's helpful because, when I run across patients that I run into this, I feel like I don't have any answers. I freeze. And so I'm like, and we always have an option too, as the care coordinators or the doctors do also. We can do, like Zac mentioned earlier, a warm handoff. If I have a patient in the office, I'll definitely, hey, would you be willing to meet with somebody just for a few minutes to talk to them? And sometimes our patients are, and sometimes they're not. And I didn't put this in a slide, and I thought about it, but I think for too many years we've had this stigma with mental health, and I think I really think we're getting past it, but maybe I'm wrong. But Zac mentioned it just a second ago. If we allow things to continue, there's a chance that maybe over many months and with some help we might find our way out of it. But I point this out to everybody. Counselors have got, they have the skill set to help you develop skills that help you get through stressful times, diabetes distress, any distress that you're in. They have those skills that they can teach you to use those in everyday life. And so I always encourage everybody to get past, if there's a stigma, to get past that, because it's not just all about your physical health. There's a mental side to it. If we're not taking care of that, in the end, that's going to end up possibly harming the physical health. So there's no reason to ignore this. Again, not especially if we're going to get serious on self-management. So we can't always change what happens to us, but we can control how we react, and we can react to changes in a positive manner. So Zac, any words of wisdom? Again, you kind of probably have said some of this, but any words of wisdom when it comes to how we can react and handle those times of stress or even distress?
Yeah, I would say be patient with yourself. Give yourself some grace. Jill touched on it before, and I'm going to touch on it again later. It's really easy at first to get overwhelmed by all the things that need done. We're focused on the big end goal and not smaller steps. But the reality of it is small changes lead up to a big change. If somebody comes up to me and they've never run in their life and they say, I'm going to run a marathon next month, they've never run, they're not active, I know that they might make it 2 blocks and then they're going to be walking home with, their hands on their hips panting. But if they take small steps, if they say, you know what, I'm going to walk around the block, and they do that for a little while, and then they're going to walk half a mile, they're going to walk 1 mile, and then they're going to run part of it. slowly but surely they build up to that goal without biting off more than they can chew and getting overwhelmed and giving up. Ask questions. Don't be afraid to ask questions. Ask for help. Talk to providers if you don't understand something. If you feel like you need somebody to talk to, if you need a therapist, we are here at Valley. If you want to talk to us about what you're going through, we are here to listen and help you. I would say be disciplined in what you're doing while giving yourself some grace, but don't look too far ahead. Like I said earlier, it can become very overwhelming and it might seem like a wall you just can't climb. I would just say, take it day by day and just focus on doing the next right thing.
So some specific things that can help I had listed, and Zach might be able to even, I don't know, Zach, you let us know, do you use any of these? Like that learn to relax, I took a little like offense to that. I'm like, what's that mean? That's kind of vague, but I get the importance of it, but I guess maybe the physical activity, the breathing exercises, the progressive relaxation, replacing negative thoughts with positive thoughts. Some of those I get, but again, when I found this information, I'm starting to think this sounds like a textbook. So can you take some of that, Zach, and could you explain like what would it mean by progressive relaxation?
Yeah. So to learning to relax. I mean, we all know how to relax, but when we're in stressful situations, this might be a little much, but the anxiety response comes from a little almond-shaped part of your brain called the amygdala. That's where the fight, flight, or freeze response lives. The part of our brain responsible for rational thought, planned out thought, is your frontal lobe. Now, when the amygdala, our fight or flight response, activates, it takes all the resources from the brain to focus on that. So literally, we're unable to utilize our frontal lobe to think rationally or logically. And so when we're in the middle of a situation, we are thinking like, I've got to get out of this situation or I'm going to die, or I'm going to get possible and play dead. We don't think about, well, if I do this, this could happen, and then maybe that. And I should really control my emotions. So what I would say when it comes to learn to relax is some of these skills, even though they seem commonplace and very obvious, you have to learn them and practice them when you're in a state of relaxation, when you can think rationally. So if we say, do these breathing exercises, I mean, I get a lot of eye rolls whenever I talk about breathing exercises, but the truth is that even though you might know it, when you're in a stressful situation, you won't use it because it's not in your toolbox. So what I would say is practice it when you're relaxed already so that it's in your awareness. So if you're sitting and watching TV and you're feeling good, just think, okay, I'm going to practice my breathing. That way, when you're in a stressful situation, you're more prone to utilize that. When it comes to progressive muscle relaxation, it essentially, it can be about a 10 to 15 minute exercise when you're maybe at home and it's quiet and you're laying down and you're recognizing that you're feeling a little elevated, a little anxious, a little stressed out. You start to get some of those symptoms of rapid heart beating, sweating, fatigue, feelings of panic. So I would say go lay down, do some breathing. And what you would do is you would relax, you would flex and relax all the muscles in your body, starting from your toes all the way up to your eyebrows, if you can do it. And what you would do is deep breathe through that. And if you're seeing a therapist or you have a desire to see a therapist, we can obviously go into that technique more in depth because it is something that you kind of have to train yourself to do. A really easy way to do breathing exercises, I'll tell people, I call it box breathing. And it is, I tell them to imagine a square. And so you would do 4 seconds breathing in, 4 seconds holding it in, 4 seconds breathing it out, and then 4 seconds holding it out. And you really want to pay attention to the ebb and the flow of your breath, that peak and that trough where you're holding it in and holding it out, and you acknowledge what's going on, the sensations in your body. And you're going to recognize that maybe in a time of panic that your heart rate is going to decrease and you're going to feel calm. And that's because our brain looks to our body to see what it should be thinking. And our body looks to our brain about what it should be feeling and how we interpret situations. And so you kind of hack your body in a way like to where it says, oh, I'm calm, my heart rate's lower, I must be okay. And then you'll notice that your anxiety goes down. Another quick way with the breathing is if you have a harder time with holding your breath in and out, they call it combat breathing. And it's just 4 seconds in, 4 seconds out. And you would do this, and for as long as you want. Really, it can be anywhere from 30 seconds to 20 minutes if you have the patience to do it.
And now you all know why I had Zac be a co-host. He's got so much information. I like getting detailed about the parts of the brain and learning more about it, but I always try to do those breathing exercises when I'm in my doctor's office and they're taking my blood pressure, because I'm always trying to get my blood pressure to make sure it's low. So I'm like doing those deep breathing things, but now I'm going to think of that box. So you can use it in other parts of life also, but these are just things that, again, if you actually met with a counselor, they could lead you through these exercises and whatever they believe would help. And, as you work as a team and learn how to do them. And like I said, I think you benefit from them from other parts of the life too, not just when it comes to managing diabetes, but in a way, again, of trying to be healthy mentally and physically. So we're all going to, feel down once in a while. That can be normal, but the feeling of sadness that just won't go away, or if life just seems hopeless for most of the day or for 2 weeks or more, is a sign of depression. And that's really when you definitely got to reach out and get some help. Don't keep feelings to yourself. Talk with your doctor. The feelings could be maybe even more from the poorly controlled diabetes, poorly controlled blood sugar, and if we can get that under control, then the overall symptoms and things that actually might work together to actually, get better control of blood sugar, but also help relieve some of the depression or stress that you're feeling. So this is what I would suggest you do at every healthcare appointment. Express how you feel about your life with diabetes. If the treatment option that your doctor or nurse practitioner is suggesting seems overwhelming, or you're just not ready to go to that step, get real with your provider and let them know that. Tell them, okay, I'm not ready for that. Could we work and do something else together? Your doctor's always looking for the best treatment. They know that if they come up with let's do this plan, and you're not really on board, there's a good chance you're not going to follow through with that plan. One thing you can do if they offer a new medication or a new way of managing diabetes is ask, can I meet with one of your care coordinators or the certified diabetic educator to learn more about this type of treatment? That would just be one visit where we could learn more about it, and then you could make your decision. Write down your concerns before you even go to your doctor's appointment, so that you can have that conversation with your doctor or nurse practitioner at Valley when you're actually here. I don't know about you, but sometimes I write those concerns down. I get into the appointment, we talk about all kinds of things, and I leave with that list and go, we didn't talk about all of these things, but at least we covered some of them. But think about that. Write these down. Have a conversation with your doctor, provider. Don't put them off, and don't think they're not important. They are. And your doctor wants to know because, again, their main goal is what they can do to help you. I want to remind you as we're closing up here is there are 6 things that you should know. Having diabetes is not your fault. Diabetes can be caused by many factors, possibly genetic. Life behaviors can trigger diabetes, including stress, lack of activity, weight gain. But this also means that there are things you can do to make it better and live healthier. Don't panic. You may recall a family member who had diabetes, and they would say things like, you can't have this, or they can't have certain food, or they have to take their medicine this way. They may have even lost a limb from uncontrolled blood sugar. Again, these are things that happen to other people. That doesn't mean it's necessarily going to happen to you. We can help you work together to have well-controlled blood sugar and decrease those, possibly push those risk factors back, that you never even encounter those risk factors. So don't ever panic. We're here to help you and support you. You don't need special food. Don't let that be a stressful situation for you. Usually the first thing someone asks me when we educate is, what can I eat? And I say this to everyone. You should eat like everyone should be eating, controlling carbohydrates, controlling portion sizes, controlling or paying attention to certain fats and salt. And those are important for everybody. So really someone who has diabetes doesn't have to do a special diet. It's what we all should be following, a healthy diet. And if I just say the word healthy diet, most of you realize that means fruits and vegetables and healthy proteins, less of the cookies and candies and stuff like that. So not that you can't have them, but less of them. Being active helps when it comes to managing diabetes and managing stress. You don't have to run a marathon, but whenever you're active, it's think about how you can be more active, I guess is what I'm thinking. Start with the basics, simple things like parking further away in the parking lot and walking further, taking the steps if that works for you, exercises that you can do at home while you're in between TV with commercials. You can get up and do some exercises. Get creative with it, I guess is what I'm saying. And activity will help with controlling blood sugar and help decrease some of the anxiety. And learn to master diabetes. It's critical. Continue attending the virtual diabetes group, find other groups that you could be a part of, and know that you're not alone. Diabetes diagnosis can be scary and can seem overwhelming. And although there are some changes that really probably do need made, you have your healthcare provider on your side. You've got, here at Valley Professionals, you have a diabetic educator, and you've got counselors like Zac here who will be willing to help you and support you in whatever we can do to help make you successful and be healthy. So I encourage you to discuss your experiences and ask questions and get involved, and anytime with our support group, definitely. On the next slide, I have some resources. Whoops, sorry, I think I went too far. Back to the resources real quick. I just wanted to list some of these out. I'm sorry, I did put the National Suicide Hotline at the top, because if it ever got so bad that that's what you're worried about, that you're actually thinking of, harming yourself, there's a 1-800 number 24/7. You can call this number, and the people on the other end have experience, know how to help you and how to get the help that you need. I would ask you to definitely call that if ever you feel that overwhelmed, whether it's diabetes or anything in life. Of course, the ADA is always an option for a resource. There's peer support for diabetes. Check out that site, because again, once you know you're not alone, sometimes it doesn't seem quite as overwhelming. The diabetes etiquette for people who don't have diabetes, that's for the family members so that they know how better to support you. You don't possibly need to hear, you can't have that piece of cake, or you shouldn't be eating that. What do you need from them as support? That's what that handout will help them know how to better help you. And then there's information about diabetes burnout, what to do when you can't take it anymore. And then I always put Diatribe. It's just a website it's ran by people who have diabetes. It's actually, I think, ran by 2 doctors who have type 1 diabetes, but they've got people writing articles on the most current information. They have that support that you might need to realize you're not alone, and just offer, more information. And to me, the more information you can have, the more knowledge we have, sometimes the better we're able to deal with whatever it is that's going on. So I just want to remind you that next month, we're going to be discussing on April 25th, reading a nutritional label. We're going to be breaking it down specifically. So a lot of times you wonder when you go to the store and you're looking at nutrition labels, what you should even be looking at. And that's what we're going to talk about next month. Definitely want to thank Zac for giving his time and his expertise. Could not have done it without him. So thank you all for attending. Download those documents and get real with yourself and actually start evaluating, what's causing stress. What's possibly blocking you from doing your best job of self-management? And if you find something that is, then give us a call so we can look over it with you. All right, everybody have a great day.